drug addiction. Drugs are chemical substances that change the way our body works. Medicines are legal drugs that are prescribed by doctors to patients. They help to cure illness and relieve pain. Drug abuse happens when people use drugs without prescriptions from doctors. They misuse drugs for reasons other than curing illnesses and relieving pains. Repeated drug abuse changes the way our brain works. These changes interfere with our ability to think clearly, control our behaviors, make good judgment, and feel normal without drugs. As this goes on, the drug abuse becomes a drug addict. He loses all control over his use of drugs. He needs more frequent and larger doses of drugs to satisfy his cravings. When he tries to stop taking drugs, he will experience withdrawal symptoms such as diarrhea, anxiety, insomnia, sweating, cramps, seizures, convulsions. Causes of drug abuse. If drug abuse only harms, why are many people still abusing drugs? There are many reasons why a person turns to drug abuse. Some people take drugs due to peer pressure. They want to fit in with a group of friends. Some are curious and some do it to relieve boredom. They believe they can withstand the drug cravings. Some do it because drugs help them feel better and forget their problems. However, this lasts only until the drugs wear off. Drugs do not solve problems but often become a problem on top of other problems the person had in the first place. Some take drugs to excel in sports. This is illegal and they will be expelled. Effects of drug abuse. Drug abuse has a great negative effects on drug addicts. They experience anxiety, fatigue, depression, and craving for more drugs. They also experience drastic weight gain or loss. They face the risk of getting high blood pressure, diabetes, heart diseases, liver diseases, cancers, cardiovascular diseases, and other health problems. Some drugs taken using syringes are responsible for spreading HIV, AIDS. Babies too can get diseases from their mothers as a result of drug abuse during pregnancy. Drug abuse can cause brain damage. It alters the way the brain functions and how it responds to external stimuli. It also diminishes creativity. Effects of drug abuse. Drug addicts can be talkative, angry, cheerful, irritable, paranoid, or apathetic when they are under the influence of drugs or when they are experiencing withdrawal symptoms. They may also engage in dangerous activities such as driving under the influence of drugs. Friends and family members feel the effects of drug addiction too. The mood swing and irresponsible behaviors of drug users are likely to cause domestic violence and poor performance at school or at work. This often results in the breakdown of families and friendships. Drug abuser usually cannot concentrate at work and will eventually lose their job. They spend a lot of money to buy drugs as drugs are illegal and not easily accessible. Many of them engage in criminal activities such as burglary and prostitution to earn money to buy drugs. addiction costs the government a lot of money for the rehabilitating of drugs addicts and treating the diseases caused by the habit. Our nation can lose a lot of human resources that can be used for national development. Our international image too will be tarnished. How to prevent drug abuse? We can follow the following steps to prevent drug abuse. Education. We must understand and be aware that drug abuse harms not just ourselves but also our family and society. With more knowledge, we are empowered to make healthy choices. Good environment. Children with a healthy, loving, and supporting environment have healthy self-respect for themselves and others. They are likely to engage in acceptable behaviors and able to make healthy decisions that will prevent them from ending up with drug addiction. Communication. Talk to your parents or teachers when you are facing any problems. They will listen to you and advise you. Healthy activities. We should engage in healthy activities like reading, playing games, dancing, or even gardening. With these activities, our leisure time is gainfully occupied. We will be happier and fitter too. Say no to drugs. We must understand how drug addiction works and we must stand firm in our ground. We must say no to drugs whenever or whoever offers them to us or persuades us to abuse them. Avoid high-risk situations. Do not go near any areas that are said to be frequented by drug addicts. If you suspect a person is a drug addict, avoid contacting or getting near him. Using medicine safely. Doctors prescribe medicines to patients to fight illnesses, make them feel better, and prevent them from getting sick. There are many kinds of medicine. Each medicine is meant for an illness. You cannot simply take medicine without the doctor's prescriptions. What should you do when you are sick? Tell your parents or teacher when you are feeling not well and follow their advice carefully. Do not buy or take the medicine by yourself. See a doctor if it does not get better after a day. Incorrect users of medicine. Wrong medicine. This happens when the medicines that you take is not meant for your illness. Over or under dosage. The dosage taken is more or less than that which is instructed or advised by the doctor. Wrong timing. The medicine is taken not at the right time as instructed or advised by the doctor. For example, before a meal, after a meal, or immediately after a meal. Wrong way usage. The medicine is used in the incorrect way. For example, some medicine should be applied to the wound, some should be swallowed, and some should be administered using syringe. Wrong patient. The medicine is given to the wrong person. Takeaway. If a label on medicine reads for external use, it means that the medicine should not be orally consumed. If we take medicine wrongly, there might be harmful reactions in our bodies. We might suffer from the side effects such as allergies and vomitings. In some bad cases, it might lead to death. Therefore, we need to know how to use the medicine safely. Do's of using medicines. Know the name of the medicine and why you are taking it. Know the side effects of the medicine and what to do when you experience a bad reaction. Understand how and when to take your medicine. Take the medicine according to the instructions or directions are given by the doctor. Complete the course of medicine given unless advised not to. It is important to prevent or relapse of the illness. If you suffer any unpleasant problems with medicine, consult the doctor. If you buy medicine over the counter, read the label of the medicine and follow the instructions carefully. Notice the manufacturing date and the expiry date. Check the quality of the medicine such as its color and smells. keep the instructions on the medicine label. Don'ts of using medicines. Do not share your medicine with your family members. Do not mix the medicines. Do not keep the medicines if you do not need them anymore. Do not take alcoholic drinks together with your medicine.